We talked about a case where we had an individual who was terrified to wash their scalp after surgery, and as a result developed this scalp issue. So I think, pre-op, post-op, it's so important. I mean, you're investing all this time and money to have this incredible, surgery and to get a beautiful artistic outcome. But preparing the scalp prior to surgeries is excellent. We also talked about how treating the hair and the scalp as a preventative measure is so important if you're considering a surgery in the future, because the quality of that surgery can depend on how well you've been treating your hair and your scalp for years. Yeah. Post-op, I think, Ashlyn will agree, but a good surgeon will tell you that, or an ethical surgeon will tell you that you need to do things to keep those hairs healthy and growing and intact. And that's usually a combination of sometimes medication, topical therapies. And so if you want good results long-term, you have to treat the scalp, you have to treat the hair before, during, and after, I think, yeah. You have to think of, hair transplants, facial plastics, it's an art as far as I see it, and that's just from the outside. So you're picking a surgeon that is an artist, and you want good results, you have to consider that. Anybody can, not anybody, but let's say you can go to school, learn the technique, but to get a beautiful result is certainly an art. So I'd love to hear your thoughts on that.
I would say you don't ever want to see me draw or paint anything, because then you would start to question my artistic skills. Look, I mean, I think there is like an artistry to it for sure. Like there's kind of like the visual aspect of like what looks good and what looks good for that face. It's easy to kind of read a textbook and say, here are these measurements, and I'm just going to apply that to every face as a template, but that doesn't really work. But I think like ultimately it's more science than art, and a lot of it is just like understanding anatomy. And so I think that is an advantage in being a surgeon and a facial plastic surgeon, is you kind of understand face anatomy, forehead anatomy, scalp anatomy. And so a lot of like when I'm designing a hairline, for example, I'm really just basing it on that person's anatomy and what kind of fits for that face. There are certain a lot of the techniques of what makes a hair transplant result look natural, and I guess that's the artistic side of it, you would say, is like it comes down to like technique, using the right instruments and making your sites at the right angle for the hairline versus in the mid scalp versus in the crown, following kind of natural hair patterns and that sort of thing. And using the right hairs in the right area. So you're only putting singles in the front. And you would think this is kind of common sense stuff, but we see it all the time.
Oh my God, I've seen it. The plugs at the frontal hairline where you have these, high density hairs, or because we see a lot of women, hairlines that are very masculine in women. Right. I mean, a woman's hairline and a man's hairline is very different.
100%. I mean, a female hairline is definitely more nuanced. It's definitely more technically demanding. We do a lot of transgender patients. And so, a patient is transitioning male to female and therefore wants to feminize their hairline because otherwise that hairline recession reads male. Yes. So that's like, a big like privilege and responsibility to kind of like transform that hairline and to create a female aesthetic to it. So there's definitely an art to that. I think there is that kind of joint artistry, but also just knowing the anatomy and applying that science to it.
Of course, art and science.